Hi, good afternoon. Good afternoon. I want to talk about the skeletal diseases and disorders. This is one of the more interesting chapters that we have. And I'm just going to give you a little thumbnail sketch. That's like a small summary for those of you who don't understand that. Because I do want you to come to me on Monday, but this is for the people who are unable to do that for one reason or another. Okay, so we're going to start with arthritis. Okay, so arthritis is simply arthro means joint and itis means inflammation of. So if you put it together in our medical terminology, as we usually do, arthritis means inflammation of the joint. Okay, and there are two main types. So we have osteoarthritis. Osteo usually means bones. And then we have the arthritis, okay? And then we have rheumatoid arthritis. Sometimes that's called RA. And unfortunately, Mrs. Bacon has both of these, okay? So usually if you have osteoarthritis, that is a natural aging process that occurs with the bones and the joints. And we can have some extra bone growth or distortions of the bones, okay? When we talk about rheumatoid arthritis, though, that's a chronic inflammatory disease. It actually is an autoimmune disease, which means it affects your immunity, it attacks your own body, and it's very degenerative, or it can harm the body a lot. With RA, or rheumatoid arthritis, it is 3 times more common in women, and it occurs between the ages of 35 and 45 most often, which is when I started having my symptoms. And it progressively attacks the bone tissue and causes scarring. So the treatment for rheumatoid arthritis is rest, exercise, prescribed medications, and steroids. I take a shot every 10 days to reduce the inflammation in my joints and to prevent further damage to my joints. Sometimes with people, it gets to the point where their joints become so disfigured and painful that they may have to have replacement of the joint. So they can have a hip replacement, a knee replacement, and so forth and so on, okay? The osteoarthritis is, usually something that progresses over time. And sometimes you may have to have a replacement of a joint, but sometimes you don't have to either. If we go to my next subject, let's see, and you're missing some great pictures. So if you want to just Google some of these things while you're listening to this explanation, just go to rheumatoid arthritis and you'll get some really nasty pictures of what that can look like. So then we can move on to bursitis, okay? Again, itis is that inflammation, right? And we talking about the bursa. The bursa is a little fluid-filled sac that is between the joints. If we didn't have bursa between the joints, we'd actually be bone on bone. And how could we move with that, right? We have to have some fluidity between the joints. So we have these little pillows of fluid between the joints to provide us with flexibility and mobility. And sometimes these can get inflamed. Okay, so there's only so much space within these joints. And if that little pillow starts to blow up a little bit, it's going to cause pressure on the bones and in that area. So obviously a symptom of this would be severe pain, limited movement because we can't move those bones because of the inflammation, and fluid in the joint. Okay, so treatment can be pain meds, steroids. We talk about steroids a lot with these different types of inflammation disorders because steroid is an anti-inflammatory. Rest, we can have something called an aspiration and physical therapy. Now, an aspiration is when you put a needle into the joint or the bursa and you would pull back and remove fluid from that area. We can do aspirations all over the body, but basically we're going to be doing it into that joint area to remove that fluid. And I've had that done before for my arthritis, and it is immediate relief of that pressure and pain within that joint. It's not very fun procedure, but it does help. So then we could talk about fractures quickly. Now, we basically, from being in my class, we know that a fracture is a broken or a cracked bone, but we have different types of fractures. Okay, so working in the emergency room, I've seen all different kinds of fractures. It's very, very interesting. And not that I have any radiological experience, but the more that you look at these x-rays, you will start to recognize, over time when you're working in the emergency room or in urgent care, how to actually be able to read some of the x-rays. I wouldn't be able to officially write the record of whatever the diagnosis is, but you would, once you see some of these bones in the x-rays, you can kind of recognize what the problem is. And then you'd also be able to say, okay, I know what the doctor's going to do. And you can kind of set up the procedure so that when the doctor goes in, it'll be all ready to go. So the first fracture we want to talk about is the green stick fracture. And that's when a bone is bent and splits and causes a crack or incomplete break. So the bone has not come through the skin, all right, but it is fractured or broken. So it's that is called a green stick fracture. And as I said, because you're unable to see my presentation at this point, you can Google any one of these pictures. I am going to put the slideshow up on the stream at some point, so you'll be able to refer to this as I am speaking. We also can have a simple or a closed fracture, and that's a complete break of the bone, but it has not come through the skin. All right, and that's a very common type of fracture. We also could have a compound or an open fracture. That's when the bone breaks and ruptures through the skin. Okay, obviously we're going to have an issue, and a compounded issue, which means an expanded issue, because now the bone has come through the skin. And whenever there's a break in the skin, right, we have a chance for infection. Okay, so we have a compounded or a more complicated fracture when this happens. Okay, so, would you want to put a cast over something that's had a break in the skin? Probably not, because you can't cover it and see what's going on with that wound. So it's a complicated issue when you have a compound fracture. We can also have another type of fracture called an impacted fracture. Okay, so a lot of you may have heard of impacted wisdom teeth. Okay, and that's when the wisdom teeth kind of come in and they're going towards the other teeth that are already in place in the mouth, and that's called impacting. Well, in this case, when we're talking about a fracture, it's when a bone actually fractures and jams right into another bone. So that's called an impacted fracture. And again, you can look at these pictures. A common muted fracture is when bone fragments or splinters into two pieces or several pieces, okay? That's a complicated issue. A lot of times you have to have surgery. Sometimes you have to have put pin placement within the bones. So that's not a good thing when that happens. We can also have something called let's see, what else do we have here? A depressed fracture. Okay, and that would be something that you would see on a skull. So it might be a severe head injury and part of the skull kind of jams in an indentation. Severe head injuries is where you would see that happen. So that's called a depressed fracture. Depressed meaning going in. And then we have something called a Colles fracture. All right, I've had 2 of my children have had Colles fractures. I saw one happening. My son was doing suicides, getting ready for his practice for soccer, and he was going backwards. He put his hands down because he was stumbling, and boom, he landed right straight on his wrist, and he fractured his wrist. The normal sign of a Colles fracture is kind of an S shape on the wrist. Okay, once you see it, and if you work in an urgent care and emergency room, you'll spot it as soon as the child comes in, because it's a lot of times it's a child that this happens to. Adults too, though. So it's usually caused by falling on an outstretched hand. Okay. So that's our fractures. We're going to move on to some other injuries and conditions that can affect the skeletal system. We've all heard of a dislocation. If you were lucky enough to go to Tim's presentation the other day, he had that awesome picture of that finger pointing in the opposite direction. You probably have heard of this term before. It's when a bone is forcibly displaced from a joint. We have to put that bone back into wherever it is that it belonged to. So if it's a shoulder, we got to pop it back in. And then there's going to be some weakness because the ligaments around it and the tendons have been stretched. So usually we have to either put it in an immobilizer, a splint, a cast, or sometimes something called traction. Okay, and I'm not going to get into traction today in this, but you can look that up. We have something that I'm sure all of you have at one time or another have done, and that's called a sprain. That is the tearing of the ligaments of a joint, at a joint. Most commonly, the wrists and ankles. You can have a sprained finger, a sprained toe. The difference between a strain and a sprain is that with a strain, okay, there is no tearing involved. It's just an overstretching of those ligaments versus a sprain is when we actually tear the joint. So it goes strain in severity. The least severe is the strain, a sprain, fracture. Okay, but we used to give out a paper when I worked in the urgent care saying a sprain can be as bad as a break because there could be just as much edema, there can be just as much pain, and if you don't take care of it because of the weakness, you could actually hurt yourself even more. We're going to move on to something called osteomyelitis, okay? And again, it's one of those itis families. So this is a bone inflammation that's due to a pathogenic organism. And we all know what pathogens are, right? Those are germs. So symptoms can include pain, an abscess actually within the bone, and you can actually get pus within the bone. So when someone has osteomyelitis, they have to be on really high dose antibiotics. Usually it has to be IV antibiotics, okay? It takes quite a while for that to heal and get over with. Sometimes people can actually lose, a finger, a toe, if it becomes very severe. We can move on to something that some of you may have heard me talk about is osteoporosis, okay? So whenever we see osteo, it means bone. Porosity or porosis means little tiny holes. If you think of a sponge, and the sponge has those little tiny holes within it. Well, our bones, okay, have a structure that is nice and strong, but as we get older, sometimes those little tiny holes in the bones can become larger, and that causes more weakness in the bone. Unfortunately, women, we're lucky enough again to have more chance of getting this issue because it can occur because of hormone deficiency, a lack of calcium, and diet, calcium in your diet, and also it can be a sedentary lifestyle. So if you don't know what a sedentary lifestyle is, that's basically being a couch potato, okay? So you want to make sure that, as a man or a woman, you keep your weight down, you eat right, drink your milk, eat your cheese, okay? And you want to make sure that you exercise. More chances of fracture with osteoporosis, okay? Because if those little holes become bigger in the bones and you fall, there's more chance that you're going to have a fracture. The next subject is a ruptured disc, okay? So we have these small little pillows, just like we have the bursa in the joints. So we have these small little discs or pillows that are in between all of the vertebrae that are supporting our spinal column. And if one of those kind of gets weak and pops out, okay, that's called a ruptured disc. It can be very, very painful. And we have these little discs between the vertebrae because, again, we don't want to have bone on bone within the vertebrae. Otherwise, we wouldn't be able to twist or turn, all right? We'd all be like solid sticks, not being able to move. All right, so ruptured discs are very, very common. Again, you need to exercise, keep your abdominal strength, your core, and that all helps to prevent that from having issues. We're going to move on to the final topic, and that is the spinal curvatures, okay? So you can definitely Google spinal curvatures, and you'll come up with all these different types of curves that your spine can come up with. All right, we have a natural curvature to our spine, but we can also have some other curvatures that happen that can cause a lot of pain and actually disfigurement to the person who has this. Most of you have probably been checked for scoliosis. That's something that you get started getting checked for around, when you're going through puberty. That's when the doctor kind of bends you over and they kind of put that level on your back and they're kind of seeing what the angle is of your back. Some of you may actually have scoliosis, okay? So usually, there's certain exercises that you have to do. Sometimes people actually have to wear braces. And then you can have the more severe issues such as kyphosis or lordosis. I always think of, I don't know if you guys know the Disney movie, The Hunchback of Notre Dame. All right, so he has that big hump. All right, that's one simple example of someone who has a severe curvature of the spine. So I hope you were able to come to our Google Meet so I could kind of go through the slide with you. But for those of you who aren't able to, I hope this helps you. Have a good day. Bye now.